We'll now turn our attention to the abdominal viscera, more specifically to the GI tract. And probably more than any other part of the body, understanding the adult anatomy of the GI tract requires an understanding of the embryology. If we can understand the embryology of the GI tract, pretty much all of the adult anatomy makes sense. So what we're going to be doing is looking at the embryology and the adult anatomy side by side. So let's start off by looking at the development of the GI tract. In our earlier discussion of early embryology, we talked about how in the 4th week of development, this 3-layered embryo, ectoderm, mesoderm, and endoderm, folded around. We talked about those as the lateral body folds. And as a result of that folding, we ended up with a 3-dimensional tube inside a tube inside a tube, and the endodermally lined gut tube becomes internalized and is now a tube that runs through the length of the embryo from the mouth end to the anus end. So this right here would represent the gut tube, which is lined by endoderm, which is the same endoderm we see here before the body folding occurred. So now let's look at that gut tube that's running through the embryo. This side view here, here's the gut tube, starting at the mouth end, running all the way through the embryo, and ending up at the anus end. Okay, that's the gut tube lined by endoderm. Now, we've already discussed one modification of this endodermal gut tube, and that modification was this ventral midline diverticulum, which we called the respiratory diverticulum, and we said that the respiratory system, the airway and the lungs, will develop from that. And we said it emerged ventrally from the ventral midline and then descended in front of the gut tube. And that's what we see here. So now we can use that point of evagination of the respiratory diverticulum from the gut tube as a landmark on the gut tube and say that all of the gut tube cranial to that is going to be called the pharynx. Okay, that's going to be called the pharynx. And we're not going to discuss the pharynx right now. We'll come back and discuss the pharynx later on when we talk about the head and the neck. For now, we'll talk about all of the rest of the gut tube. And all of the remainder of the gut tube, caudal to the pharynx or caudal to the respiratory diverticulum, is going to be divided into 3 regions, and those 3 regions will be called foregut, midgut, and hindgut. And the basis for that division into those 3 portions is the blood supply to the gut tube. So what we see here in this schematic is the aorta, the abdominal aorta, running down the posterior wall of the abdomen. And coming from that aorta, we have 3 blood vessels that supply the gut tube: a celiac trunk or celiac artery, a superior mesenteric artery, and an inferior mesenteric artery. And so what we do simply is say that part of the gut tube that gets its blood supply from the celiac trunk, we're going to call foregut. The part of the gut tube that gets its blood supply from the superior mesenteric artery, we will call midgut. And the part of the gut tube that gets its blood supply from the inferior mesenteric artery, we will call hindgut. And then we'll be able to determine that those 3 parts of the gut tube, foregut, midgut, and hindgut, will each give rise to a series of adult organs. So we can talk about foregut organs, midgut organs, and hindgut organs. And so what we already know, therefore, is that any foregut organ is an organ that gets its blood supply from the celiac trunk. Or we can say it the other way. Any organ that gets its blood supply from the celiac trunk is a foregut organ. And similarly, we can say the same thing about midgut organs getting blood supply from the superior mesenteric and hindgut from the inferior mesenteric. We can also draw an inference from this, and that is that any organ that's in the region of the junction between foregut and midgut is probably going to be an organ that will get overlapping blood supply from branches of the celiac and branches of the superior mesenteric. And an organ that's at the junction of midgut and hindgut will be an organ that will get overlapping blood supply from branches of the superior mesenteric and inferior mesenteric. So that indeed is going to be the case, and we'll deal with that in some detail in a little while. So let's take a look at what organs are derived from which parts of the gut tube. So on this slide we have 3 columns representing foregut, midgut, and hindgut. And we're talking only about the abdominal viscera, the abdominal GI tract at this point. And so from the foregut, we see that we get the esophagus and stomach and part of the duodenum, listed as first and second parts of the duodenum. And then some other organs that are going to be derived from the foregut, which we will talk about. But in terms of the tube itself, esophagus, stomach, and part of the duodenum come from the foregut. From the midgut, we get part of the duodenum, second, third, and fourth parts, and then the jejunum, ileum, cecum, and appendix, the ascending colon, and part of the transverse colon. And then from the hindgut, we get the remainder of the transverse colon, the descending colon, sigmoid colon, rectum, and the anal canal. Now, going back to what we said about blood supply, we can see that the duodenum, the second part of the duodenum, is listed in the first column, and the second part of the duodenum is listed in this midgut column. So that's saying to me that the junction between foregut and midgut is somewhere within the second part of the duodenum. And so therefore I would anticipate that it's in the region of the second part of the duodenum that I will have overlapping blood supply between celiac and superior mesenteric artery branches. And similarly, I see that the transverse colon is listed here and the transverse colon is listed here. And so it's someplace in the region of the distal transverse colon. That is the junction between midgut and hindgut. So that's where I would look to find overlapping blood supply between superior mesenteric branches and inferior mesenteric branches. And indeed, we will find that later on. Now, not only does the knowledge of which part of the gut tube gave rise to the organ tell us something about the blood supply, but it turns out it tells us some other things as well. So, looking at this chart, if we look at the first entries, it's saying what we've already said, that the artery for the foregut is the celiac, the artery for the midgut is superior mesenteric, the artery for the hindgut is the inferior mesenteric. So since we now know which organs come from which part of the gut tube, we know what their blood supply is. The next entry tells us about parasympathetic innervation. When we talked about parasympathetic supply, we talked about parasympathetics in the abdomen either coming from the vagus or coming from sacral parasympathetics. And when we discussed that with the autonomic nervous system, we sort of generalized and said upper abdominal versus lower abdominal organs, or vagal versus sacral. But now we can be more specific, and we can say that foregut and midgut organs get their parasympathetic innervation from the vagus, and hindgut organs get their innervation from pelvic splanchnics. So S2, 3, and 4. So if we know which part of the gut tube an organ comes from, we know what its parasympathetic supply is. Similarly, we said that the sympathetic supply to these visceral organs comes by way of pre-aortic ganglia, and we talked about the celiac ganglion and the superior mesenteric ganglion and the inferior mesenteric ganglion with their postganglionic fibers traveling with the blood supply. So if we know which part of the gut tube the organ is from, we know what its postganglionic sympathetic supply is. And then we can sort of backtrack and say that preganglionics that synapse on the celiac come from T5 to T12, similarly for the superior mesenteric, whereas for the inferior mesenteric from T11 to T12. So now, if we know which part of the gut tube the organ comes from, we know its arterial supply, we know its parasympathetic supply, and we know its sympathetic supply. And lastly, we talked a little while ago about the fact that pain referred from these GI tract organs will be referred to the abdominal wall in the midline to either the epigastrium, the umbilical region, or the hypogastrium, depending upon where the organ came from. So a foregut organ, let's say the stomach, will have its pain referred to the epigastrium. A midgut organ, let's say the appendix, would have its pain referred to the umbilical region, and a hindgut organ, let's say the sigmoid colon, for example, would have its pain referred to the hypogastrium. So knowing where the pain, the visceral pain is referring to, narrows down which organs that pain may be arising from.